Gentlemen, I want you to picture this. Waking up tomorrow with a kind of firmness you haven't felt in years, naturally. No pills, no pumps, no risky treatments. Just your own hands, a few minutes of your time, and some simple but precise techniques that reactivate your body's natural ability to produce an erection. I'm Dr. Jocelyn White, a prostate doctor with over a decade of experience helping men restore their sexual vitality. And today, I'm going to guide you through 3 key pressure points on your manhood and surrounding area that can help bring back those strong, automatic morning erections. These points work by improving blood flow, relaxing specific muscles, and boosting nerve responsiveness. If you've noticed that your morning erections have become less frequent or less firm, stay with me. By the end of this, you'll know exactly where these points are, how to stimulate them safely, and how often to do it for noticeable results. But before we begin, if you really care this bad about your erections and moreover your full health, do me a favor. Please subscribe to the channel and watch this video till the end, as only your motivation is what helped me keep making such content. Without further ado, let's begin. Before we dive into the where and how, it's important to understand why this approach works. Because once you understand the science, you'll see that you're not just pressing on skin, you're activating one of the most powerful systems in the male body. Erections aren't random. They're the result of a coordinated effort between the brain, spinal cord, blood vessels, nerves, and muscles. It all starts with nerve signals, tiny electrical messages that travel from your brain or sensory nerves down to the erectile tissue. These signals tell the smooth muscles in the penis to relax, allowing blood to rush into the spongy chambers called the corpora cavernosa. As they fill, veins that would normally drain blood away are compressed, trapping blood inside and creating firmness. But with age, this system doesn't work as well. Blood vessels lose flexibility, nerve signals slow down, and mild inflammation or conditions like high blood pressure can interfere. This double effect, sluggish circulation and weaker nerve signals, is why morning erections begin to fade as you hit your 50s or 60s. That's where targeted pressure point stimulation comes in. When you press or massage certain areas, you're not just working the surface. You're activating clusters of sensory nerve endings that feed directly into reflex pathways responsible for erections. These signals travel not just locally, but up to the sacral region of the spinal cord, the control center for erections. This sets off a chain reaction, relaxing the smooth muscle, widening arteries, improving blood flow, and stimulating pelvic floor muscles that support and maintain erections. When done consistently, this hands-on technique can retrain your erectile reflexes, improve vascular flexibility, and sharpen nerve sensitivity, essentially waking up the system and getting it working like it used to. Pressure point 1. The base groove, the first area we're going to target, is called the base groove. It's located at the root of your manhood, where the shaft meets the pubic area. To locate it, run your fingers along the underside of your shaft, moving toward your body. You'll feel a slight groove or indentation, a natural hinge where erectile tissue blends into the deeper structures anchored in the pelvis. It may feel slightly firmer or textured compared to other areas. That's your spot. Why is this area so powerful? Beneath the skin lies a dense network of sensory nerve endings, including branches of the dorsal nerve of the penis, plus key blood vessel junctions that feed the erectile chambers. Think of it as a control hub where your nervous system and circulatory system converge. Position your thumb directly over the base groove. Support the shaft with your fingers behind it. Apply moderate pressure enough to feel the tissue, but never painful. Begin slow, small circular motions, letting the warmth of your touch spread. As you work the area, you might notice a subtle tingling, warmth, or fullness, signs that blood flow is increasing and nerves are waking up. Over time, daily stimulation increases responsiveness and improves your body's ability to react to arousal cues. Do this every morning, ideally before you get out of bed or during a warm shower when tissues are relaxed. Just 90 seconds a day can start to retrain the reflexes that control your erections. Pressure point 2. The perineum, the second point, is slightly hidden, but extremely important. The perineum, that soft, springy patch of tissue located between the scrotum and the anus. Most men overlook it, but it's crucial for erection strength and control because it sits directly above the bulbospongiosus muscle, a key muscle in your pelvic floor responsible for trapping blood in the penis during arousal. Think of it like a natural clamp that helps maintain an erection. With age, this muscle tends to weaken. But by stimulating the perineum, you can reflexively activate and strengthen it, giving it a workout without having to do traditional pelvic exercises. Sit comfortably or lie on your back with knees slightly apart. Using your index and middle finger, press gently but firmly into the center of the perineum. Move in slow, deliberate circles, staying in the center of the spot. You should feel a slight resistance under your fingers. That's the muscle responding. You may also feel warmth or pulsing, a sign that circulation is improving. Spend 2 to 3 minutes here, keeping your touch steady and controlled. For added effect, combine this with light Kegel exercises before or after the massage. This not only helps in the moment, but trains the muscle to contract more powerfully during actual arousal, making erections feel fuller and last longer. Pressure point 3. The Glans Ring, corona. The third and final point is found in one of the most sensitive regions of the male anatomy, just beneath the head of the penis, at the base of the glans. Specifically, we're focusing on the corona, that ring-like ridge where the glans meets the shaft. This area is packed with a dense concentration of sensory nerve endings. These nerves are responsible for sending the brain those rapid-fire arousal signals that initiate an erection. Stimulating this ridge gently, with just the right amount of pressure and rhythm, can dramatically enhance nerve responsiveness and make it easier to go from arousal to a full erection. Think of it like fine-tuning your body's arousal circuitry. But there's a catch. Too much pressure or overstimulation here can backfire, overwhelming the nerves and actually reducing sensitivity. This area responds best to controlled, moderate touch. 1. Using your thumb and forefinger, gently grip either side of the corona. 2. Apply a light pinch, just enough pressure to feel it, then hold for about 5 seconds. 3. Slowly release. 4. Repeat this hold and release cycle for about 1 minute. Next, move into gentle circular motions. Use your fingers to trace slow, soft circles around the entire circumference of the corona. Keep the motion light, smooth, and deliberate, just enough to wake up the sensory nerves without causing irritation. This combination, first the hold release, then circular stimulation, helps activate the erection center in your spinal cord and retrain sensory responsiveness. When practiced consistently, this can lead to more frequent and firmer morning erections, as well as a general improvement in arousal during intimacy. Remember, this isn't about intensity. It's about precision and consistency. Putting it all together, your full daily routine now that you know all 3 pressure points, here's how to combine them into a simple, powerful daily sequence. Treat this like a workout for your erectile system, quick, targeted, and designed for results over time. Step-by-step routine. 1. Base groove, 1.5 minutes. Small circular motions at the root of your shaft. Use moderate pressure until the area feels warm and responsive. 2. Perineum, 2 to 3 minutes. Gentle pressure and slow circles between the scrotum and anus. Activate pelvic floor muscles and boost blood flow. 3. Glans Ring, 2 minutes. 1 minute of light pinch and hold at the corona. 1 minute of slow circular motion around the ridge. You should do it for about 5 to 7 minutes per day. And the best time to do it is in the morning, ideally while still in bed or during a warm shower. This is when your body is naturally relaxed, making the tissues more responsive. When done together, these 3 techniques work in unison to improve circulation to the penis, activate and tone the pelvic floor muscles, enhance nerve communication between your manhood and brain. You're stimulating every major system involved in achieving and maintaining an erection: vascular, muscular, and neurological. What to expect and when. Let's set clear, realistic expectations. This is not a magic trick. You're not going to wake up tomorrow with the erections of a 20-year-old. Your body needs time to respond, rewire, and rebuild these connections. However, most men who follow this routine daily begin to notice subtle, but encouraging changes within 2 to 4 weeks. A stronger sense of warmth or fullness in the mornings, erections that start more easily and last longer. A general return of pelvic vitality. A sense of readiness and energy with consistent practice over a couple of months. You may experience a measurable difference in how your body responds, not just in the morning, but during intimacy as well. This technique is powerful, but you'll get far better results if you support it with a few key lifestyle habits. Stay hydrated. Adequate water improves blood volume and helps maintain proper circulation. Do regular Kegel exercises. These strengthen your pelvic floor, amplifying the benefits of pressure point work. Eat for blood flow. Leafy greens, beets, berries, and healthy fats like nuts and olive oil all support vascular health. Avoid smoking and excess alcohol, as both damage the very systems you're trying to repair. Move your body daily. Even light walking improves pelvic circulation and nerve health. By making this a holistic routine, you're not just treating a symptom, you're training your body to function the way it was meant to. Gentlemen, weaker, or vanishing morning erections don't have to be accepted as just another part of aging. Your body hasn't lost the ability, it's just lost the stimulation and support it needs. By consistently stimulating these 3 pressure points, you're retraining your nerves, reviving blood flow, strengthening the muscles that support firm, lasting erections. And you're doing it in a way that's safe, drug-free, and entirely within your control. If this has been helpful, make it part of your daily rhythm and give it time. Many men are surprised at how much progress they can make in just a few short weeks. And remember, your sexual health is a mirror of your overall health. Every positive change you make in your circulation, muscle tone, or nervous system supports not just better erections, but a better quality of life.